Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today we have in with us a longtime friend and patient, Mr. Kent DeSales from Iota, same town as me. And we've seen Kent as a patient probably 15 years ago.
Yes, it's been quite a while. Actually, when you first started your practice, it's been a long time.
That's right, been a long time. So Kent was doing good. He's bounced around through different careers and different other chiropractors. And he's back in here with us today because he's been researching Dr. Johnson and myself doing the decompression, the manual ring dinger adjustment on the y-axis. So he's like, hey, studying, using his own logic and common sense, applying what he's seeing to what he's feeling. He's like, I think this thing can help me. And lo and behold, me being your former chiropractor, he's back in here to experience that with us today. So Kent presented with neck pain radiating down into the left shoulder. That's right?
Yep.
A little bit of tingling down the arm. Nothing
yeah,
too bad.
Nothing major. Just at times it's worse than others, you know.
Okay, right.
But yeah.
Yeah, that's the chief complaint.
Right.
So he works at a desk, computer job, a lot of computer work, sitting, head forward posture, etc. All things we would expect to straighten out the cervical curve and put stress on some of these nerves that exit the cervical spine and go down the arm. We just did his x-rays and exam. We found some compressive stress at C5, C6, C7. So we're gonna target those areas, as well a little bit of compressive stress down here at the sacrum, and we'll be adjusting that as well. So we're gonna start out on the biophysics table, and then we're gonna finish up with the thing you came for, man.
All right, sounds
ring
good.
dinger.
Ring
All
dinger.
right. Let's go ahead and go face down before we can. Okay, we're gonna check your leg length again. All right, a little short on the right. That's to be expected with an ASIN on the right. Let's bend those knees, and that gets longer. Does that tighten up in your lower back?
A little bit when you're all the way up.
Okay. All right, I want to pay a lot of attention to that sacrum too, because we saw a misalignment there on that x-ray. All right, you're gonna feel that piece kick up. We're gonna start working in that pelvis.
Okay.
Now we're adjusting him right ASIN. Okay, that's anterior superior, internally rotated ilium. Now PIEX on this side here. And to that base posterior sacrum. Fire off those lumbars a little bit. Okay, chin up for me. There we go. Good release, my man. All right. Now you're gonna feel the cervicals kick up right here, Ken. Go to work on that C5, C6, C7, and adjusting on the Z axis right here. Okay, we're going P to A with those segments. All right, my man, roll it on over for me. Okay, hands on the tummy. Okay, let's put those arms in a T. The more joints we can fire off, the more powerful the stimulation into the brain, man. Okay, hands on the tummy, sir. Loosen that knee up. All right,
Cool.
good. Good one. Probably felt that in your lower back too, huh?
That all moved.
Same thing here. Let the leg dangle. Okay, good. There we go. Let's go ahead and sit up. Swing it around here.
All right.
We're gonna knock the crepitus out of those shoulders. Your range of motion's pretty decent.
That one's not bad.
Yeah. Ooh. Huh?
This one's it's a little different.
Yeah, it's a little crusty in there. No, you're not left-handed though, huh?
Mm-mm.
Okay, we'll let that arm dangle. Give a little torque out on the humerus, and we're gonna go I to S, loose. Okay, good. Yeah, it's a little crunchy in there. Might have the beginnings of a little, something called adhesive capsulitis in there, because I can feel the restriction in the rotation of the shoulder. But after a few adjustments on it, we'll get it cleaned out. Get some scar tissue in there broken up. And you definitely want to ice that.
Okay.
Ice and stretch.
Yeah, that one felt quite a bit tighter than the other
yeah,
side.
it is a lot
It's a
tighter.
big difference.
A great stretch for the shoulder is just kind of hanging, just like we recommend inversion table and hanging from the feet. Get yourself a chin-up bar, set of monkey bars, grab a hold, get that shoulder at max range of motion, 180 degrees from the body, and then just let yourself hang there a little bit, okay? That's gonna stretch that shoulder capsule. The most important thing is to continue moving.
Right.
Instinct is to like not move and let it heal. With something like adhesive capsulitis or frozen shoulder syndrome, you want to move it, right? Not rest it too much.
Yeah, I find myself wanting to hinder it, you know, kind of hold it to my body a little more.
Exactly.
The other side.
And that's the instinct. So we gotta oppose that and definitely stretch. The stretching is more passive when you do it that way. Okay. So again, getting your arm up there and just letting your body drop down a little bit. If you get your feet off the ground, that's fine too. You can hang there
just put the weight off of it.
5, 8, 10 seconds, and do that repeatedly every day, a little bit every day.
Okay.
It'll keep that shoulder from freeing up. All right, my man. Let's
Here we
get you
go.
over here, yep. You're gonna decompress that neck. All right, sit here and here. Good, scooch you down a little bit. Pelvis lines up. All right. How many of these videos you watch, Kent? Don't lie.
So, you know, it's been a couple years that I've kind of seen Johnson's videos on YouTube, and I watched them for a period of time, like a bunch of them, and then I was watching them just a few weeks ago and seen you were in there. I said, well, look at this. So now that I knew somebody local was doing it, I said, well, it's time.
A loco yoko. No, it's taken the chiropractic world by storm, man. You know, people are seeking this thing out. They're Googling ring dinger. They're doing searches.
You know, I've been to different chiropractors, and you seem to get the same style of adjustment. You know, side to side, you know, down your back. This is just a different style. I don't know.
That's all X-axis and Z-axis, and we know through neurology and through orthopedics that if we can adjust certain joints will subluxate or misalign predominantly on certain planes, either the X-axis, the Y-axis, or the Z-axis. Almost every one of them will subluxate on the Y-axis, right? So that's common for almost every joint because of gravity. Gravity is always pulling it down. Every joint is subject to a Y-axis type misalignment and fixation. So that's the beauty of this thing. Like when I started seeing Dr. Johnson do it, it made instant sense to me with what I knew.
Right, from the experience in the past.
Yeah, and so I just wanted to learn more.
Yeah.
Eventually became certified. All right.
We'll have to find out.
Yeah, this is going to be a tight squeeze, okay?
Okay.
So you got some Buddha in there this morning?
Yes, sir.
All right. Just let that pin sink in there. All right. I was so surprised how tight that felt first time it was done to me. Okay, good. Legs in neutral. I'm a little taller. I like my table high. All righty, sir. Let's lift the head a little bit. Okay, get that towel in a good position. All right, Kent, back teeth touching. Don't bite your tongue. Breathe through the nose. And wiggle your fourth ear. Oh, breathe, breathe, breathe. Don't forget to breathe. And let it settle in.
And I felt that all the way down the top of my pelvis.
That's the idea.
All the adjustments I've had, I've never had one like that.
That's awesome, man. That was exactly my experience. It lights up the spine, lights up the brain, and decompresses the entire spine. I didn't know that either until I felt it. I was like, that literally went down to my sacrum.
I mean, all the way,
Yeah, all the way down and through. Wow. Ring dinger. Look, his duck bumps.
Mm-hmm.
That was a good one. Okay. Continue to work and release that C5, C6 area. That's it, my man. You tolerated it well.
Wow. So that was everything I expected it to be.
Good, good. Miss Darcy's next. This is a shout out to Darcy. We're coming for you.
I'm working on her.
All right, man. Walk that off.
I feel taller.
You do? You look taller. Seriously, he looks taller. That's wild. All right, Chief. Let's have you sit right here. I'm gonna clean up the upper cervical a little bit. Extend those legs out in front of you. Just straighten them out. That's it.
I'm still working off the jitters.
That's it, man. That's it. Let it settle in. I want to get some laterality out of the atlas. The first bone in the neck will subluxate predominantly on the x-axis too. So a little bit of left laterality I want to take care of. Take the tension out. Focus on letting the shoulder fall. That's it. That's fine. I'm gonna drop down and work the C2 a little bit. I mean, you're released though. There's hardly any, there's no real pressure left in there. I like to decompress these station tubes. All right, there you go, buddy. What you think?
So it's a different adjustment for sure, and I think it's gonna do some good because I had a lot of movement today.
All right.
The last chiropractor I went to was not giving me any movement like I've had today.
Right. Okay.
Even on this table,
Yeah.
my back moved more than it has in the past.
Okay.
That one was totally different.
That was totally
That's
different.
a new experience.
So how's your range of motion feel in your neck right now?
So it's good. So normally I can always turn to the right, no problem.
No
when
problem.
I go this way, it's normally burns. I got a burn sensation.
You feel that?
Right now it's not there.
Not there. What about extension, tilting back?
No, it's a little tight upper left,
Okay.
but it's not. I mean, it's
So we're gonna hit that 2 or 3 times, and by the 3rd or 4th adjustment, it should be cleared out completely.
good. I hope so. That's the plan.
All right, my man. Any questions from me?
No.
Well, thanks for letting us video the experience. Kid.
Okay.
I appreciate
You're
it.
welcome.
If you like this material, please subscribe to the channel, share with your friends and family, hit the bell for notifications. This is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.